So next I am going to invite Dr. Omkar Botre, who is going to speak on posture assessment. Very brief about Dr. Omkar Botre. He has completed bachelor's in physiotherapy from Kaher Institute of Physiotherapy, completed master's in sports physiotherapy from KLE Institute of Physiotherapy, served as a former physiotherapist for Junior Commando Wing, Belgavi for 2 years, served as a former physiotherapist for the 6th Roll Ball World Cup, published 2 research papers in the Journal of Education and Society, a UGC Care Accredited Bilingual Multidisciplinary Referred Journal, completed a course in biomedical research, former physiotherapist at Super B Triathlon, recognized as the former physiotherapist for 51-hour non-stop roll ball relay, listed in Asia Book of Records, awarded second prize in paper presentation at Thinkathon by IAP Women's Cell, participated in first international osteopathy and manual therapy conference in New Delhi, served as a former physiotherapist at the Guinness Books of World Record event for most completing 100 meters on skates, held from 27th May to 31st May 2023. We welcome Dr. Omkar Botre on behalf of Beauty Club. I hope he will not threaten us with all those answers. But definitely some posture assessment which will help us beyond 1 minute of walking. Thank you. I would be audible.
So you can keep the mic away from the computer, from the laptop. Then the sound will not come.
Okay.
Good.
It's getting recorded now, so the voice will be clear.
Am I audible, everyone?
Yes.
Okay, good enough.
Very mic will be better.
A very warm welcome to everyone present here. Thank you, Arunima Singh, to give me this opportunity to present here in front of today. So I am Dr. Omkar and today's topic is on posture. Mainly this would be related to your sitting posture. So here are 2 images which you can see. One is a right posture of sitting, one is a wrong posture of sitting. The first one, this posture is the wrong way of sitting, wherein the person is very much slouched in front of his laptop. What are the ill effects of this posture? You can see the red marked areas. There is triggering pain at the neck area, at the elbow, at his lower back, at the knee, and at the ankles, due to constant sitting in the wrong position for several hours. But on the other hand, if you see, the second person is sitting erect, and he is not going to suffer from all such kind of pain. Rather, his onset of pain would be delayed compared to a person who is sitting in a wrong position. Now, what are the long-term effects of sitting? It would lead to weight gain due to decreased metabolism. It would lead to compromised posture. It would lead to a poor stamina, increased blood pressure. Further, it would also lead to weakness in your bones and muscles, secondary to osteoarthritis in a longer run. Now, let me make you understand what is ergonomics. Basically, it is a branch of science that is designed to make your workstations, machines and tasks, keeping in mind about the human capabilities and limitations, so that the productivity from the human beings is maximum and reducing undue fatigue on them. Okay, so I wanted to ask, how many of you are using wallets right now? Is it there in your back pocket? It is there. Okay, so just watch the simulation. First image shows when you are sitting, your 2 hips, this and this side, pelvis, is in a normal alignment. Because of that, your spine is straight. But if there is constant use of wallet on one side of your hip, what happens on a longer run? Just check. Your hip gets tilted, which leads to compensate the changes in your spine. I am not saying that this is going to happen during one sitting session, but when you are doing this for a longer period of time, over the years, there would be slight changes occurring. And this would lead to triggering your neck pain, back pain, shoulder pain. Okay, you guys do not remove your wallets now, you can change it up. Okay. So let's check the image. Because of the compensatory changes, what happens? When a person is in a sound alignment, the hips are in level, the spine is normal, the ribcage is in level, and the shoulder girdle is in level. But due to compensatory changes, your head goes one side up,
which leads to changes in the spine, and your rib cage also shifts and leads to uneven shoulder levels. This again leads to decreased intake of oxygen because the ribs cannot expand properly while you're breathing. So this is a 20-20 rule. What I want you guys to do is, for every 20 minutes of work, I want you to take 20 seconds of rest and look 20 feet away. This is going to reduce more of your eye strain and strains that are causing headaches. Now let's see. This is an impaired posture, this is a correct posture. And these are the differences between a impaired and a correct posture. If the posture is wrong, there is soreness, pain, tingling in your arms and your fingers. Further, low self-esteem, your overall height looks short. Okay. Compared to a correct posture, you would delay your pain onset at mainly musculoskeletal sites. Okay. Further, there would be higher confidence, higher self-esteem. You would have a better breathing pattern. Okay. And there would be an increase in height. Because see, whenever you're slouching, your overall height is decreasing. But if you're standing erect, you look bold enough, you look in a very proper form. So what are 11 benefits of a great posture? You work out better. Your cardiovascular endurance is better. You tend to relax more efficiently. You work more efficiently. Further, your core stability is increased. Your performance is increased. Also, your productivity is also going to be increased. So, understand. What I want you guys to notice is, you guys need to make a change. Once you start making a change, it would only take 4 weeks for you to see that change in yourself. For your friends and family, it would take 8 weeks to see that change in you. And for the surrounding world, it would take 12 weeks to notice that significant change that has occurred in you. So, just keep on addressing your problem and start making a change in your posture. 6 tips to minimize the risk of injury. First is, remember to move around. As Dr. Nikita said, sitting for a longer duration is going to give you some or other compensation regarding pain. So I want you to move. Take frequent breaks during your work. Okay. Take breaks, stretch. Secondly is, whenever you are lifting a heavy object, always go into a wide stance and bend your knees. Do not directly bend and lift it. And when you have lifted the object, do not twist, because that is going to create all the more load on the spine. These tips are only for the people who are not going in a right posture. But if they do any kind of sudden movement, it is going to lead to back pain, shoulder pain, neck pain. Now, when can a person say he is fit? If he is able to do all his activities of daily living with vigor. If he is not, if he is enjoying his pursuit time and free time whenever it is present. Second, there is no undue fatigue in doing any of the activity. Fourth is, if he is meeting unforeseen emergencies, he is able to cope up with it with very minimal amount of stress. This was it for today. What I want to conclude is, on daily basis, we are seeing at least 3 to 4 people who are from the corporate world dealing with such kind of pains. And it is majorly the neck pain, the shoulder pain and the lower back pain. And understand, the pain is not like it is going to come within one go. It is because of a faulty patterns of sitting or throughout your life that is triggering this kind of pain. So you make small changes in this posture and you can resolve your pain by your own self. You wouldn't need to see the doctor itself. Okay, stretch around, move around, because your body is meant to move around. It is not meant to sit in one place for a longer duration. It is just because of the work profile, we need to sit and do the work. But I want you to address this change. Only then you can make changes. That's it for today, and I would like to conclude my talk.
All those fixtures or attachments, how good or bad they are in order to maintain postures.
Now let's go here. Check this image. So this chair is not having an armrest. It is not having a footrest. But look at this ergonomic chair. The back is supported. All the chairs have a back support. But do we use that back support is the question. All the chairs are having an armrest. Do we use the armrest? That is a question. Look at this. When there is an armrest, your elbow is completely rested on the armrest. There is no extra muscular activity that is happening to stabilize your elbow joint. But when there is no armrest, the person is typing, and his biceps and triceps and forearm muscles are going into constant tension, which creates pain. Getting the point? That's why the ergonomic chairs which are available for sure is going to help to reduce down your onset of pain.
That's the lumbar support actually now. What you are seeing in that second is lumbar support.
Yeah, obviously. Upper back,
There are chairs with lumbar support and without lumbar. So we have to
He's saying
be
every chair is
mindful.
not a backrest.
Every
No,
chair is
but
a backrest.
you have to be mindful of buying a chair with lumbar support.
And the armrest also.
Yeah, and armrest.
Armrest is
There are some
this traditional chair seat, you can see on which you are sitting. It is having an armrest. It is having a back support. So you can sit properly. But consider if there was no backrest. All you would do is go in forward direction, slouch and bend, or you would lean backward. All the more creating more pressure on your spine.
Dr. Omkar, there are chairs which are sold as an ergonomic chair, which are very costly chair, and there are some chairs which have a backrest and the armrest. As that is his question.
Exactly.
Like which one actually you should choose? Should you go for those ergonomics one, which they actually show
Not
they are
necessary
going
that you have to
backward?
spend a huge amount
More
on it.
expensive chairs.
It is necessary that you should know what is the proper sitting
I've been
position.
using a QS pen chair, only 18,000 rupees, very economic design, comfortable chair. And you can operate for a couple of hours also. One of the major problems what I observe, whenever they are making the presentation, they are showing a desktop. Now the age of desktop is over. The problem has come after everybody is migrated to laptop.
Yes.
Laptop, your screen goes down, it is not at all recommended to have your vision. And I have gone through the whole last 1.5 years. Your laptop screen has to be 15 degree down your eye level. That should be there. So I think
That's the stand for the laptop also is come. So I understand.
get the screen.
That's right.
And one of the
Because neck problem चालू हो जाएगा.
one of the major problems is that we go to a screen. Rather than we going to a screen, let a screen come to us. That will make you more comfortable.
And see,
Let
let me give you a very good example. See this position. Is the head in the center? No, right? Now tell me if you are given a task to balance a football at your head, on your head, how are you going to balance it? By keeping it forward? Is it going to balance? By keeping it backward? No. Side to side? No. It has to be in center, right? Consider the football to be your head. If the head is not in the center of the body, it is going to show you pain signs in longer run. Getting the point? Any more questions?
What is the advice for the bed? How the bed should be? There are various beds available nowadays. You know, the one who goes along with the body and like.
Right. See, what we speak about bed is, see, there are too many different types of bed in the market. What I would suggest you is do not use the bed, lie on the floor, because it is a very rigid surface. But now if you were wanting to buy a bed, I want it to be non-compressible. It should have a memory foam, so that even if it compresses, it again recoils back every time. जो normal cotton की गद्दियाँ जो देखे हो आपने, ठीक है, वो जब भी whenever you are lying down, it would compress and create that indentation, and it would get what do you say? Yeah, because of the pressure, it would just keep an indentation, and whenever you go multiple times on that bed, it would keep lot of pressure on your body part. Consider it to be your buttock region, consider it to be your heel region or your head region. So make sure you're using such kind of beds which are again, which can recoil back to its original position again.
But these are some orthopedic
Orthopedic
mats which are coming,
mattresses, yeah.
Galvan and all that. No? So I
Yeah,
think those are
these are
sleep
all
sets.
different
Not
brand
use
names.
coir board beds. Coir board beds are bad. So even if there is a spring in a coir board, it
No,
is
no, but
bad.
these are
It should
orthopedic.
be, no, what he's saying is memory foam.
हाँ तो orthopedic वाले
Yeah, even they use the same thing. Memory foam ही use करते हैं.
So I think
Different brands give different names to that thing, and it is all the more confusion for people which to select and which not to select. Anything else?
I used to travel my workplace by a car, and it takes roughly 2 hours and one side. I have back pain due to this, but if I suppose leave the car and go by train, it's not happening. Do you think that anything that we can do to modify it, because in the car the back seat is we cannot adjust?
See, let's not adjust the seat, but you can incorporate 3 exercises which I would show you now. Okay. What happens is when you are in this position, right? There is all the more tightness at the chest, all the more tightness at this front aspect of the neck. Your this part and your shoulder blades are always in a stretched position. All you got to do is tighten the stretched muscles and loosen up the tightened muscles. Basically stretch your pectoralis by just protracting the shoulders out. Okay, this is one form of stretch for the shoulder, chest muscle. I am showing you 3 exercises for strengthening the back muscles. First is get your hand this way, squeeze the shoulder blades. Okay, this, like this. Second is you can do this. All this 30 repetitions every day. Third is chest out, arms outstretched, thumbs pointing towards the ceiling, and move it backwards. If you move it forwards, you are activating your chest muscles. But if you are moving it backwards, you are activating your weaker rhomboids and your shoulder muscles. And all the more you would start feeling your chest is out, back is contracted, and you will start feeling better. Okay?
You don't need to do it possible. Use the
Right, it is not working. Neck, shoulder, yeah, right.
That is a quick fix. What you are saying. A collar. For a longer and you cannot be dependent on collar, right?
I've tried it also.
It wouldn't work because your muscles are lacking strength to hold it in a constant position, to hold the head in a erected position. So start addressing this problem and do the changes. Changes means I'm saying do the exercises for it. Just hold it just now. Okay? Thank you.
Thank you, Dr. Omkar. So, being in sales in my office, I always see operational people, हर 10-15 मिनट में चाय पीने बाहर जाते हैं और हमेशा यही सोचते हैं हम लोग इनको काम धंधा है कि नहीं, ये बार नीचे जाते हैं। आप समझ में आए कि कोई ऑक्सीजन लेने जा रहा है, 1 मिनट का ब्रेक ले रहा है या कोई 20 मिनट्स का ब्रेक ले रहा है। But jokes apart, I think what Dr. Singh and Dr. Botre gave us is taking break for ourselves and doing little exercises which will help our spine, our neck, and end of the day when we reach home after our work, we see a lot of stress which happens because of pain in our body parts. But on the way, on the traffic signal, if we are able to move our neck, the problem that he told, similar problem I also face, most of us face who are driving, going to office or way back or meetings. So there are some small exercises that we can incorporate and feel healthy and become more healthier.